Good morning, everybody, and welcome to Monday Morning Mocha. I am your host, Dr. Greg Todd, and I am ecstatic to be joined today by this amazing human services juggernaut, the Interim Director of Operations for Craig's Door, Jennifer Sandova. Thank you so much for joining us today.
Oh, and thank you, Greg. It's equally ecstatic for me to be here with an amazing person like yourself.
Mhm.
And this is pretty exciting to get to do this.
Yeah, I'm excited too. So before we get into some awesome material, you do amazing stuff in the community. So just talk to us a little bit about like some of the things, because it seems like you're
Sure.
having your hands in every pot, so to speak.
Yeah, definitely. So you introduced me as the interim, director of operations for Craig's Door, which is a congregate adult housing first shelter out in Amherst, Massachusetts. But I also play a full-time role as the clinical director for a program known as Low Threshold Permanent Housing and Supports. It's a new program supported by the Department of Public Health here in the Western Mass area. And I work for Open Door Community Services, which is an affiliate of the South Middlesex Opportunity Council, SMOC, which is a large housing organization.
Mhm.
So yeah, my group and my team, a fabulous group of individuals from the area,
Mhm.
we do several things. Our division primarily works on housing those that are unhoused that cannot find housing really anywhere else. Greg, they are they're under a low threshold contract, meaning that their quarries may be a roadblock for them getting housing.
A huge issue. Yeah.
Definitely a huge issue.
Yeah.
A lot of the folks that we deal with here in the community that we interface with quite a lot, it's simple impediments to them getting housing. They don't have an ID. They don't have a birth certificate. And a lot of times they just don't know how to get that.
Absolutely.
Or
Yeah.
they don't have the money to do it.
Yeah.
Really.
Yeah.
So those are some basic things that we do, but the larger scale of it all, myself and my team, through street outreach, which we're going to talk about today, we go out and we find those that are the most difficult to house. If this contract primarily targets those that are being commercially, sexually exploited and trafficked on the street, those that might be living with or at risk for HIV, those that use substances and may have a component of mental illness involved with that. And so these are the folks that you see out there sleeping on the streets that really can't even get into Section 8. They can't get a Section 8 voucher. They can't get into regular housing services because they can't pass a query, or their query is so significant that perhaps maybe they wouldn't really fit into regular housing. So that's just a little bit of the component of what we do.
Absolutely. I appreciate that. So I think you and I linked up with this new model that we're going to talk about.
Yeah.
New outreach model. So tell me a little bit about, in your brain, how do you think this came about?
Well, this is just a fascinating story to me because it's been really exciting and it's been such an amazing opportunity to meet you and to meet the folks at MOCHA and to collaborate. So the whole premise of what we do, what my team and I do, it's about collaboration, where no one agency is going to solve these problems that are out there, right? It takes a lot of us with a lot of different skill sets that have, we're all different stakeholders in the same game. And that is trying to help those that are less fortunate than ourselves, those that are unhoused and dealing with significant mental illness and food insecurity. And so we started our, working relationship when it came to, we were approached by you and you had let us know that MOCHA had the ability to help agencies with certain special projects that they would like to do. You were forming an affinity group. And you asked us what projects we wanted to work on and if we had one. And I certainly did.
Yeah,
I was, I think, probably out of everybody the most excited because I had been studying a lot, about different models for street outreach.
Yeah.
So just a quick, explanation about this contract.
Absolutely.
It's twofold, right? So yes, we do housing services and we house people that are unhoused, but we also do a lot of street outreach, and street outreach can be very tricky, and there's all different ways to do it. Everybody has a different idea of what works, but I really wanted to do my due diligence and really do the research. So I took a lot of courses and studied a lot and try to find what's out there that resonates with me that I think that we could replicate here in Western Mass.
Absolutely.
And so, researched this amazing research paper on capacity building. And, just real simple without getting into the complexities of capacity building. What it is when you have a problem and you want to solve that problem, the best way to do it is to combine forces. And so you find stakeholders in the community that have a vested interest. And with those stakeholders, each different stakeholder has an agency that's trying to target something different. So for example, I had mentioned to you earlier that part of our contract is to work with those that are being commercially sexually exploited and trafficked on the street. Well, so we may know about that topic and we may have had trainings about that topic, but are we experts? No, we're not. So under this capacity building, model, we reached out to key organizations that we felt had a vested interest in what we're doing. So we reached out to, the first group was My Life, My Choice.
Right. Fabulous
Fabulous organization that works. All of their employees work, they have lived life experience. They've been in the life. They've been out there on the streets. They were trafficked and, sexually exploited as young kids, and then grew up and they wanted out of the life. And they started this amazing organization, first started in Boston. And so we reached out to them first and said, hey, listen, my team needs a lot of training and we'd really like you to jump on board with this. We're starting this affinity group. I introduced you to, you met Nikki. And so we first joined with those folks at My Life, My Choice. And then it grew from there. We said to ourselves, okay, well, who are the rest of the stakeholders? So we deal with folks that, of course, a lot of our contract, we have to go out there on the streets and work on harm reduction, right? So, one of our tasks is to go out there. We have to give out, clean sex kits, clean needle kits. And we try to make sure that we are, sending a message of harm reduction and how do we get these people some help? So sure, we know how to do that, but are we the experts? No. But who do we know that is? Well, Tapestry. Tapestry is where we get all of our educational material from. They do our trainings. They give us their Narcan. They give us the condoms. So, we reached out to the directors that run the facilities out in Springfield in Northampton, and they were eager to jump on board. And we've been so blessed to have them join up. And then from there, it expanded out where we were told that we might want to communicate with Christina Beaujolais, who is a director who runs the RFK Community Alliance. And they also work on folks that have been commercially sexually exploited and trafficked. So that alliance just kept growing. And then we reached out to Craig's Door Home Association out in Amherst, Mass. They are a low threshold shelter, and they had a lot of guests that really were folks that my team had reached out to and started to house. So they jumped on board too. So the premise is that we wanted to really learn as much first about the best practices around street outreach. What works? What doesn't? What is going to be our best approach from every aspect of doing street outreach, right? From safety to cultural competency, to trauma-informed care. And so what we embarked on is we decided what's going to work for us. So we first all met, had lots of meetings about what we'd like to do, what we'd like to see. And the first phase was we rolled out a survey project, which The good folks at Craig's Stores were very helpful in helping us run that.
Mhm.
And so, Greg, you and I worked on, putting together, a regular a survey, just some regular basic questions for folks. We started off with a participant survey number sample where we had 15 our first
I
time.
think so. Yeah.
Yeah,
As I
it's about
remember. Yeah.
15. And so, the participants were asked various questions about approach, with street outreach. If you're living rough
Mhm.
out there, and actually, Greg, I should probably back up a little bit. I talk about street outreach, and everybody knows where street outreach is, but I'll clarify. So, street outreach is when an organization like myself tries to go where folks are living rough.
Mm.
So, it's easy to see the people that are having a difficult time. We work on School and High Street,
Yeah.
and of course, it's a very busy area, we'll
Yes.
say.
Yes.
And there's no shortage of clientele out there. And we go there every day. We work there and make sure people are good. And we distribute out harm reduction there. But really, the street outreach, we go where folks are living rough. So whether it's Court Square or down by the river,
Right.
all the vacant buildings.
Mhm.
Yeah.
Yeah.
So my team and I, we go there, and that's where we try to meet people where they're at, because a lot of people don't really know that services are out there.
Right.
Not everybody is beating down your door and know how to get to you.
Yeah.
And a lot of people are hiding out. They have reasons to be hiding out, and they fear people. They fear, what will happen if they're found.
Yeah.
And they don't know that there's stuff out there for them that, they can receive services.
Absolutely.
So we go out there to do triage case management, where we try to make sure they understand what services are available to them, and we give them whatever service is there.
So before you talk a little bit about the survey, why do you think human service programs, agencies have been missing the mark with regards to outreach? Or is that a loaded question?
No, it's not a loaded question at all. I think there's a lot of agencies that, have really, done well. I mean, there's definitely effective outreach that's going on out there. I will give a shout out to Tapestry. They have mobile units everywhere. There's also Between the Bridge, which is an excellent organization that is amazing with street outreach. And I know there's plenty of others. Just for my own knowledge, those are the two that I know, real well.
Yeah.
But the great thing about the capacity building, and which answers your question about why I think people miss the mark, is this, right?
Yeah.
Okay. So simple model. Say, my agency, we have limited funding, limited money. So I can hire, one, maybe two street outreach workers. But how effective is that? We have strict rules about safety, right? We never go anywhere alone. So we have to go in packs. So it's really hard when you don't have a big workforce to do this.
Right.
And then when you go, of course we have knowledge, and we have experience, and we have skill sets, and we know where to send people. But how great is it if you collaborate, or to use the terms of Sister Anna Muhammad, if you cross-pollinate with other agencies? If I hook up with Tapestry, well, then now I have a larger workforce, right? And they already have people that go out and do outreach. They're already, paid to do outreach. I hook up with MOCHA. I mean, MOCHA, you guys have an outreach, component. And so, and same with the RFK Community Alliance, we hook up with them. And so all these different agencies, and My Life, My Choice. So instead of me just having myself and my workers, which is a small group of people with a limited skill set, we take in all these members now of all these different groups. And now we're one large group with a really large skill set and a much larger ability to give the answers that these people want and send them to the right place. And with all that expertise going out there on the street, then we're going to be able to do a lot better work.
Absolutely.
So that's what it's all about. Yeah.
So what I hear is more manpower, more collective expertise.
Yeah.
Anything else? Because I mean, the model sounds amazing, and as we've been talking about it, I've been super excited about the impact, that it could have, on the community and stuff. But what else? What else does it incorporate that that you think makes it like revolutionary? Yeah.
Well, there's a lot of things that make it revolutionary, and there's a lot. Also, there's with this cross, collaboration, pollination. These groups are all coming from different cultural backgrounds too, and perspectives. Many have. It's great because a lot of people have a better capacity for speaking different languages than maybe my group. How difficult is it, when you're hiring to find somebody that's, can be bilingual or, thankfully in our case, we've been able to find people that are multilingual. So, when you're capacity building and you have all these different stakeholders with these different abilities and funding sources and trainings and just all of that body of knowledge and that their back experience all combined together, it just makes it such a strong team. And it's not only other agencies either. It's health departments. It's so it's health. So, medical health services, social services, and of course, then all the regular nonprofits that have a stake in, those that are unhoused, those that are, dealing with mental illness and addiction.
Absolutely.
So it just makes it more of a comprehensive type of a model.
Yeah.
And then when you put this all together, because I know we're going to get into talking a little bit about best practices and why we're doing the survey.
Absolutely.
Yeah.
And that's okay. So I had a very interesting talk yesterday with Vanessa Otoro, who's the Executive Director of Healing Racism Institute. And our discussion was actually about how for-profit agencies need to start incorporating human service components to make themselves more effective.
Right.
Right. And so I know that you and I had talked about, and we're exploring this idea of almost the reverse, where we're as a for-profit, as a nonprofit perspective, we are starting to incorporate for-profit things like customer service training.
Yes.
Right.
Very true.
Right.
Yeah.
So I'm wondering, as you've, gotten yourself hands deep in this project, any other thoughts about like additions that you could be making?
Yeah, absolutely. And so you couldn't, have been more true about the fact that now it's about customer service because that's what it's all about, right?
Yeah.
We are providing a service. And so our customers that we're providing the service for are those that are unhoused and are in need. They're not, a client or they're our customer. And so if they're our customer, we're taking on more of the for-profit world's,
acumen.
Acumen of how to do effective customer service.
Yeah.
And so, the next phase actually of this project, after we're done working on the surveys, is to put in a training video that we would like to do on customer service, where we have a trained customer service individual who's been in the business for a long time and knows how to do effective, good quality customer service. And so we want all of our workers that are going to be doing, street outreach to go through this training and to really understand that we're there for the customer, because that's the best way, you need to treat everybody with dignity and respect. And there's no difference between that customer that, is coming in to buy a car and that customer that needs a roof over their head,
Definitely. And I think what I like about the model as well, and we can start talking a little bit about the survey. The information that you're collecting is not just for the participants, and it's not just for the model, but it's how you're training your staff.
Absolutely.
And the things that are really needed by your stakeholders that they need to get from the staff, right? One of the things that you shared with me yesterday was about your interaction with one of your stakeholders outside of Open Pantry, right?
Right.
And what I appreciated about that was that it was a heartfelt interaction, you know, like, and so my question is like, how do you instill that sort of desire in staff, right? Without burnout, you know,
Right.
And still maintaining that level of enthusiasm, still maintaining that level of involvement. Because I mean, you know, you and I have been in this business forever, right? And understanding that we're not here for the money, right?
Yes. Nobody comes to these fields for the money. Yeah.
Absolutely. So, you know, one of the biggest things I'm excited about is that this model is able to instill the passion in your workers for serving this population.
Absolutely.
You know?
Yeah.
So,
You know, yeah, it's true. And I'm glad you brought that up because, you know, yeah, we did have a good conversation about that. And one thing that anybody that works in this field knows that the only way to really stay truly engaged and not to burn out is one, you have to have genuine compassion. You have to have a thick skin for sure. Most importantly, you need to have a really good sense of humor because you cannot go into this type of work wanting to help those that really need help and assistance, thinking that you are going to be met with, you know, always gratitude. Because not. Because most folks you're working with, you know, they're at the, you know, really the lowest point, you know, of their life. They're struggling just to maintain day by day, right? You know, and they don't always see things, you know, maybe the way that you see it. You know, you may feel like you're doing something great and wonderful for them, but really that wasn't really what they wanted.
Right.
You know?
Right.
So it's for us really learning about what people really want and what the best approach to use with them is. And then for us to do a lot of debriefing with one another and to be able to run those scenarios by one another about, you know, when people are not, let's say, not grateful, because we're not doing it for people to be grateful to us, right? We're doing it because it's the right thing to do. These are human beings and they need dignity and respect. And when you're in a position where you can help somebody, you just help them. You don't do it because of, you know, the adoration, right? Because you know what I mean? Because if you're in it for adoration and for that warm, fuzzy feeling you get when you can help somebody that's really in need, it's really not the field for you. You have to just have genuine compassion for human beings and just know that it's not always going to work out like that. But if you do have one of those stories and you do have somebody that, you know, thanks you or gives you a hug or has made you enlightened you that you've done something to help them, then that's a good day. You know, I can live on that for a long while.
Absolutely. It's funny. When I first got into this field, like fresh out of grad school, I read this article and I think it was called like, "Is human service altruism altruistic?"
Right.
Right.
Yeah.
You know, with this thought that I think everybody initially gets into this field with this idea that they want to serve selflessly, right?
Right.
With the paradox being that sometimes that's not really true, right? Sometimes we need that feedback. Sometimes we need that.
Sure.
So
yeah, that validation that what we're doing is actually doing some good because we're all human.
Yeah. Yeah.
You know, and if we feel like we're just hamsters in a habit trail, just constantly spinning, but not seeing a result, then anybody could get burnt out.
Right.
Yeah.
Right. Yeah. And so sometimes I wonder, like, you know, and even as you're moving forward with this project, how do you think you're going to tackle something like that? Like being able to keep people energized if not, I don't want to say accolades, but if the adoration or if their work is not being received in the way that they want it to be received by stakeholders.
Right. Yeah.
Yeah.
No, that is good. It's a challenge for anybody, right? Yeah. You know, this is probably 34 years for me working in, you know, high risk, you know, populations doing, you know, working with, you know, a lot of folks that, you know, get burnt out very easy because they go into there thinking, you know, they're going to be able to save the world. And,
Yes. Yes.
the only way to save the world is by all of us having, that single-minded, mission of knowing that we just do what's right.
Right.
Yeah. And we do it from the heart, and we do it because it's the right thing to do. We don't do it because we're waiting for, your picture in the paper or that interview where you've, surprised some person with a new home,
That's right.
Because that's not life.
Yeah.
That's just made for the news and made for, TV
Absolutely.
stories. But I tell you though, on every single day, I mean, one thing that my team and I've noticed about other people that we've, been able to collaborate with is gratitude.
Yeah.
We all have that ability to be grateful and to know that each and every day there are so many things to be grateful for, just in our own lives. Just the fact that you woke up that morning,
Absolutely.
is wow, what a miracle, right? How'd that happen? We just take things for granted. So, I try really hard. We do a lot of training and a lot of discussions, a lot of debriefing on how to keep grounded and how to just have realistic goals and expectations of people. And that when you have that success, just some quick examples of that, our agency, we were given 14 slots to fill of these really of people that it's been really difficult for them to be housed. I mean, there's been people that were out there for like 25 years, not really coming in, and we've been able to house them. And, a lot of times, a lot of reasons why people are unhoused is because, as they say, they don't play nice, in the sandbox with one another. It's hard, people, mental illness really plays a big part in a lot of the unhoused, a lot of people that are living rough out there on the streets. And
so just to be clear, it's not just sometimes lack of availability of housing.
Oh yeah, definitely. And a lot of times, we see a lot of like professionals that have, hold degrees that are out there on the streets. And it's, whether they went through a life event like a divorce or a loss of a parent, where maybe that's where they were living and that's where their housing came from. There's all sorts of stories like that of people, that are out there, because you're right. When I first came into this field, and not to get too sidetracked, but when I first came here, I, anticipated a lot of the folks that we would meet and be helping are those that, substance were the issue, right? No, it's really just that's actually a really small portion of the ones that we work with. Most of it is, mental health. And, another part of it is just life circumstances.
Absolutely.
They are in situations where as kids, maybe they grew up in the system, maybe they, ran off, got, into a life that they were, led into and then now can't get out of, that we're trying to, support them. And, that's a lot of people out there,
with different needs.
Definitely different needs. And, sometimes it's just as simple as an ID or getting their birth certificate that can then send them off, because we have somebody that has been out there for 25 years. We'll call him Joe.
Sure.
And so, this individual recently, we were able to get him his birth certificate. And from getting in his birth certificate, he was then able to get his mass ID. Then he was able to get driving lessons. Then after that, he was able to get the mass ID, get his driver's license. And then he bought a car for the first time in his life, because we do pay for our contract. We pay for the rent. And for the first year of housing, it's a housing first premise. So we just needed to get them into housing. And then everything else will work on, to make sure that they can get out of their situation. And so now Joe has, mass ID, has his vehicle, and was able to get insurance. I mean, there's been so many things that we just take for granted, that we just get every day. But for those folks that are in certain circumstances, that is just a monumental feat right there. So to me, that's a great success story for him to be able to do that.
That's amazing. That's super amazing. So my last thought before I get you out of here, I know you and I talk a lot about like policy and practice. Right. And just a little bit about my experience. My mom, who you actually might have known, was a social worker, and there was always this tug and pull between creating effective policies that could be linked to effective practices, right?
Yeah.
And so I guess, as I grew up, there was always this gap that existed, where agencies were creating amazing policies, but for some reason the practices weren't playing out
right
as well. What has been your experience with that, especially in the outreach?
Yeah, we've learned a lot about that, actually.
Yeah.
I think definitely policies that can be put into practice that I think are lacking, right? And that I think I've learned through this survey experience with our participants is definitely two things. One, cultural competency, policies that can be put into practice, and trauma-informed care.
Yes.
I think those are the two
ones
that are lacking. I've taken a lot of different courses on best practices for street outreach, and there's a lot of amazing, international, national organizations that you can take courses from that are wonderful. The Homeless Hub, it's great. National Alliance, to End Homelessness. But one thing that I do notice, because I write a lot of policy and procedure for the jobs that I do, and I think that that's definitely a component that is missing, that I really want to make sure that, because the end goal of this whole experience is we're writing a training manual and we're writing a best practices book on doing effective street outreach in Western Massachusetts. And those are definitely two areas that I feel that as I go forward to write the policies and put into practice, those are two components I need to add.
That's fantastic.
Yeah.
Thank you. Jen, it's been a pleasure.
Oh, it's been an absolute pleasure. Yes. Thank you so much, Greg. I really appreciate this opportunity to come on and talk about this exciting project.
Absolutely.
And hopefully we can talk about it more in the future when it's done.
We will. Thank you. And I would love to have you on again.
Oh, excellent. Thank you.
Thank you, everybody, for listening. And that's a wrap.